Do you sometimes feel like your balance is off, like you're about to fall, even when standing still? Or maybe you've noticed that sounds seem muffled, as if you're hearing through water. These might not just be small issues. They could be signs of something going on in your nerves. Neurofibromatosis Type 2, NF2, is a rare condition where unusual growths, called tumors, develop on nerves connected to your brain and spine. These tumors mostly form on the hearing and balance nerves, so people with NF2 often struggle with hearing loss or ringing in the ears. Think of it like a wire bundle, your nerve with a slow-growing knot, the tumor that messes up the signal, like a phone call with bad reception. It's not common, but it's serious, and usually shows up in teens or young adults. Imagine your body has instruction manuals, your genes, that tell your cells how to grow and behave. In NF2, there's a typo in one of those manuals, a mistake in the NF2 gene on chromosome 22. This gene normally makes a protein called myelin that acts like a brake to stop cells from growing too much. But when the gene is broken, the brake doesn't work, and tumors start growing on nerves. Now, here's the part you might relate to. About half of the people with NF2 inherited this faulty gene from a parent, like getting a family trait, but not for eye color, for a medical condition. The other half, the typo just happened randomly when they were being born, no family history at all. So it's like a 50-50 mix of passed down or bad luck. So what does NF2 actually feel like in real life? Let's picture this. Say you're watching your favorite show, but one ear suddenly hears less clearly. Or maybe you keep dropping things because one hand feels weak, like your fingers don't listen to your brain. These could be early signs. The most common symptom is hearing loss, often in both ears over time, because tumors grow on the nerves that carry sound. People might also hear ringing, tinnitus, feel dizzy, like the room is spinning, or have facial weakness, like one side of your smile doesn't work right. Some even feel numbness or muscle twitches in arms or legs, because tumors can pop up on other nerves too. And in some cases, vision gets blurry if tumors affect nerves in the eyes. It's not one single thing. It's a mix of nerve-related glitches that slowly build up. How do doctors figure out if someone has NF2? It's not like a cold, where a test gives a quick answer. Instead, they look at symptoms, family history, and special scans. For example, if someone in their 20s has hearing loss and balance issues, a doctor might order an MRI, a detailed picture of the brain and nerves, to spot tumors on the hearing nerves called vestibular schwannomas. Finding tumors on both sides is a big clue for NF2. Genetic testing can also check for the faulty gene, like reading the instruction manual to find the typo. As for treatment, there's no cure yet, but doctors can help manage it. Options include surgery to remove tumors, but that's risky near delicate nerves, radiation to shrink them, or hearing aids, and cochlear implants to help with hearing. Some people even use sign language or lip reading as their hearing fades. The goal is not to fix everything at once, but to keep quality of life as normal as possible. Can NF2 be prevented? Right now, we can't stop the gene typo from happening, especially the random kind. But if a family knows they carry the NF2 gene, they can make informed choices. For example, parents with NF2 might talk to a genetic counselor, like a guide who explains the odds, and learn that each of their kids has a 50% chance of inheriting it. Some choose prenatal testing during pregnancy, or consider IVF with genetic screening to lower the risk. While you can't prevent NF2 itself, early detection can help. Kids in affected families often get regular hearing tests and MRIs, so problems are caught early, like fixing a small leak before it floods the house. So prevention isn't about avoiding it completely for everyone, but about being ready and taking smart steps if you're at risk. Good news, scientists aren't giving up. Recent research is exploring new drugs that can slow or shrink NF2 tumors without surgery. For example, drugs like selumetinib and bevacizumab have shown promise in trials. They don't cure NF2, but some patients report better hearing or slower tumor growth. Think of these as tumor breaks that might replace the missing myelin protein. Another exciting area is gene therapy. The idea of fixing the broken NF2 gene directly, like editing the typo in the instruction manual. It's still experimental, but early lab results are hopeful. Also, better imaging and hearing tech are helping track NF2 more precisely. So while today's treatments focus on managing symptoms, tomorrow's might target the root cause.